Time now for Morning Rounds with CBS News chief medical correspondent Dr. Jon LaPook and CBS News contributor Dr. Narula. First up, mammograms. They are one of the best-known screening methods for detecting breast cancer. But while not common, these types of tests can yield false positive results. A new study published by the American Society of Cancer Research looked at the impact that false positive results can have. False positive results are estimated to be as high as 12%, with the numbers highest for women ages 40 to 49. The study notes that roughly 50% of women who screen annually for a period of 10 years can expect a false positive, with 7 to 17% requiring a biopsy as a result. So, Tara, what are the practical impacts of false positives?
Well, any one of us who's had a false positive at some point in time from a test can tell you and attest to the fact that it takes a toll. It takes a toll financially, physically, and psychologically. And it's not surprising that it might alter your behavior when it comes to the next time you need to have a test and whether you choose to have it. And in fact, in this study, they did find that. And so 22% of women who had a false positive were less likely to go on to have their next mammogram, as opposed to 15% of women who had a true negative, who were less likely to go on to have another mammogram.
Interesting.
So, John, if it's causing delays in follow-ups, I mean, how long are the delays?
Significant, okay?
Yeah.
So it turned out the delay in getting their follow-up was 13 months for women with false positives, only 3 months for women with true negatives. And the reason why this is so important is right at the very beginning of the article, the authors point out that mammography, screening mammography, has been shown to decrease mortality from breast cancer.
That's an important fact to remember. Tara, did the study touch on ways to improve the rescreening rate after false positives?
Well, the authors really say that it's very important that we as the medical community continue to educate women about the importance of getting your recommended annual or biennial screening mammograms, whatever it might be, and that we can pick up these early stage cancers when they're easier to treat, decrease mortality. But I think at the end of the day, it really speaks to that doctor-patient relationship. It's very easy for a patient to just avoid and say, I'm not going to get it, I'm scared, I'm worried, and for the doctor to say, this is recommended, do it, do it, do it. What you really need is that dialogue, that empathy, the listening and communication, so you can understand what your patient's feeling and be able to talk about it and talk them through getting the next one.
And it's the same thing for any kind of test. You know, with PSAs with men to detect prostate cancer, you say to them beforehand, listen, it may be elevated, doesn't mean you have prostate cancer.
Yep.
Let me prepare you for what might happen.
Next up, hearing loss. It's the third most common chronic health condition in the U.S. And a new report by the CDC highlights the damaging effect loud noises can have on ear health. And it's not only those who work in noisy environments who feel the impact. The report shows that an estimated 40 million Americans ages 20 to 69 have noise-induced hearing loss. And more than half of the people who do not work in noisy environments still have damage as a result of noise. Are most Americans taking enough precautions, John?
Definitely not. About 70% of adults who are exposed to loud noises either never or seldom use protection. Now, about 1 in 4 adults